Time for our Fox 4 House Call with Dr. Andy. And this morning we're talking about something that's been in the media for, like, gosh, it seems like the last month. Every time you turn around, another toy recalled because of lead.
Right.
So we're talking about lead poisoning. How big of a problem is this? What do we need to look out for?
Lead is surprisingly a much larger problem than most parents out there realize. Between 2 and 8% of children in the United States today actually suffer from some type of lead poisoning.
Still today?
Still today. Now, mind you, these are more often in kids from low-income houses, most often in kids in inner cities, but even in our area, there's a small percentage of children that suffer from lead poisoning.
So they pick up, Thomas the Train, and it has some lead in the paint. They're immediately going to get sick. How do they get sick?
Well, that's a good question. One good thing about all these toy recalls is parents are listening much more acutely these days when we talk to them about lead poisoning and lead screening. The danger from the Thomas the Train, or actually these Elmo toys and Dora the Explorer toys and some of the Disney toys, are more that they might have lead leaching from them years from now down the road. Now, actually, most of the lead is still the same sources that we had before the toy recalls, and that is from paint in the walls of these older homes and in the soil. Okay,
so what do we do? What do you notice the signs of lead poisoning? Is it obvious?
That's part of the biggest problem, is that it's not obvious. The subtle signs of low levels of lead poisoning are difficulties learning, behavioral problems, confusion, sometimes a drop in the IQ or the measure of intelligence. So sometimes kids just not progressing in school the way we expect them to.
Or they just don't seem as on their feet as they used to.
Exactly. And so then there's so many things that we can all think of, like ADD, ADHD, other types of learning disabilities, social stressors that can mimic those symptoms. So it's very easy to miss.
So what do we do? Do we get tested? Is there a test?
That's a good question. We screen for it. And believe it or not, we screen for it every time we see your children. We ask questions about what kind of home they live in, how old is the house, because older homes more likely to have lead paint. What kind of neighborhood they live in, who other kids are in the house. And then quite often when they get a little older, we might actually about a year, sometimes again around 3 or 4 years of age, we'll actually check the lead level if some of those questions come back and make us concerned.
So really, what's the bottom line best piece of advice for parents?
Talk to your doctor, and I'm almost certain your doctor will reassure you that they have been actually screening through talking and by checking levels. And if your doctor hasn't been, it's a very easy test to do. Your doctor can order it for you now.
There you go. If you have any more questions about lead poisoning or any other medical topic, always feel free to give Dr. Andy a buzz. You can give him a call 694-6246 or shoot him an email at draol@phc-md.com, and we'll put